Today's question is, what is the background behind hoarding? Who are most often the victims of it, and what is the motivation of it? Okay, well, hoarding disorder is a recognized mental health condition, and it's characterized by difficulty in discarding items because of a perceived necessity to keep them. And, distress that is associated with getting rid of them is very, very real. The precise cause of hoarding disorder still isn't really known, but we think it involves a combination of genetic factors, differences in brain functioning, and environmental influence. There is evidence suggesting that hoarding tendencies can run in families, which I suppose could indicate a potential genetic connection. However, we still need way more research on this to fully understand this relationship. Some studies have identified differences in brain activity between individuals with hoarding disorder and those without it, particularly in brain areas that are related to decision making and risk assessment. But there's no one consensus. Environmental factors also play a significant role. Often, people who exhibit hoarding behaviors have a history of maybe traumatic events or substantial life stressors, such as losing a loved one or going through a divorce, maybe even something like an eviction, or losing their possessions due maybe to some disaster. And these experiences may instigate the onset of hoarding behavior. And the disorder can affect anyone, but it's much more common in older adults. Typically, uh, the condition tends to worsen with age as well. And it's often associated with other mental health disorders like depression, anxiety, PTSD sometimes, and sometimes ADHD as well. Now, as for the motivation behind hoarding, sufferers often form really intense emotional attachments to their possessions, and they may see these possessions as extensions of themselves almost, or experience a sense of safety or comfort or control from collecting and storing these things. The thing is, the thought of discarding their possessions can induce intense anxiety and distress in them. Now, you have to remember as well that hoarding differs greatly from collecting, in that collectors consciously seek out very specific items and usually organize them quite meticulously, and then they take pleasure in displaying what they've collected. Now, in contrast to that, people who hoard save random items. It can be things like newspapers or magazines or milk cartons, and they store them in a hugely disorganized manner, which of course often disrupts their living spaces and of course their overall quality of life. Treating the disorder usually involves cognitive behavioral therapy, and this helps sufferers understand their hoarding tendencies, and it can help them learn how to categorize and organize items as well, and improve decision making and coping skills. Sometimes medications such as SSRIs can also be beneficial, especially when it's combined with therapy. But hoarding can be a really difficult condition to treat, mainly because people who hoard don't see it as a problem, or they lack the insight into their behavior to see it as a problem. Now, I'm sure you've seen those TV programs about people suffering from hoarding, and I have to be honest with you, they piss me off no end. They really do. Because you can't cure hoarding with someone who helps you to reorganize your wardrobe. What do they call them? These, organizer people? Uh, or a team of cleaners who come in making screwed up faces at somebody's distress. I mean, can you imagine making the same kind of TV program about people with severe depression, for example, and acting in the same manner? It wouldn't be tolerated, and it wouldn't make such great TV. Hoarders, because of popular culture and because of these TV programs, have been vilified and made fun of. And they're making fun of what is a real, genuine, debilitating mental health condition. It's not okay. Anyway, hope that answers your question.